Good morning and thank you for joining us. My name is Tina Tebow and I will be your moderator for this morning's news conference. Joining us today, the Honourable Steve McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Dr. Strang will give us an update on COVID-19 in Nova Scotia today.
Thank you, Premier. Good afternoon, everybody. Today we're announcing 12 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 122. Where the investigations are complete, we can say that those are travel-related or connected to earlier cases. We have some cases where case investigation is still ongoing. At this time, no cases show clear evidence of community spread, but we all need to be prepared that this will happen and may be happening right now, and we'll pick it up with our expanded testing. What Nova Scotians are doing, by and large, staying home, practicing good hygiene, self-isolating if they're unwell, is helping. The individuals affected by COVID-19 thus far range in age from under 10 to mid-70s. We have 3 individuals that are currently being treated in hospital, and I'm able to report today that we now have 7 of our earlier cases that can be considered that they have recovered. None of the cases that none of the cases that we reported yesterday or today are linked to some of the group events that there's been public announcements on, whether it's the hockey games, the basketball tournament, the St. Patrick's Day event. So that's good news. We haven't seen spread from those large group events. To date, Nova Scotia has tested 4,731 people whose results are negative. And I'd like to thank the QE2 lab. Yesterday, in the last 24 hours, we tested almost 800, or roughly 800 people. So we've quadrupled where we were at last week of being able to test only 200 people. So that's due to the hard effort at the lab and the leadership of Drs. Hatchett and LeBlanc. So I want to thank them for that. We now have a 3rd long-term care facility where a staff member has tested positive, along with the other 2 that were announced yesterday. Residents and family and staff at this 3rd facility are being notified. Public Health is working closely with the facility administrators, and the steps that were put in place at the 2 facilities yesterday are being put in place at this 3rd facility. And not at any of the 3 facilities, I'm pleased to be able to say that the test results from the 2 that were announced yesterday have all come back, both for residents and staff, have all come back negative. At none of the facilities or any of the residents or staff who are close contacts showing any symptoms. Their staff are being put off for 14 days for self-isolation. Residents in the facility are being grouped and separated from the rest of the facility, what we call cohorting, and they are being monitored very closely. We now have a directive that in all long-term care facilities, residents need to have their temperatures checked twice a day. And in the 3 facilities where residents may have been exposed, as I said, they're cohorting and they're being even more closely monitored, and if they become symptomatic, we will test them again and move from there. So people need to understand the importance. This is why of protecting our long-term care facilities. We have clear plans and processes in place that are working, but it's vitally important that people adhere to what we put in place. No visitors in long-term care facilities, no trips of residents out into the community. These people are the most vulnerable for getting severe disease and even dying from COVID-19, and it's critical that we do everything we can to protect them. We know that most of our positive cases are in the 20 to 60-year-olds. We do not have any cases of people 80 and above, and few cases in people between 60 and 80, and that's good, because the older population is more vulnerable, along with the elderly. People with underlying health conditions, our healthcare workers who are putting themselves on the line every day to be prepared and to treat people with COVID-19. All those groups need our help. They need us to help them to stay safe. So it's really important that if you are on self-isolation, you stay on self-isolation. If even if you're just being asked to social distance like all Nova Scotians, and you start to feel unwell, for whatever reason, it's important to go home and isolate yourself until you figure out what's happening, and if you need help, you can call 811. All the things we put in place are absolutely necessary to keep the rest of us safe. We have had, I've heard lots of reports. One of my colleagues her husband works as a police officer, and he's saying the streets of Halifax are empty. And this is happening across the province. By and large, most people are doing what we're asking to do, and I thank them for that. However, not everybody is. We still have reports around people getting together, group activities. We have to take this seriously. We are all at risk. As we've said, there are people who are at greater risk of getting this disease and severe illness and dying, but we are seeing around the world, even young people, previously healthy, some of them get sick and get very sick and are dying. So everybody is at some risk. This is a serious disease. It makes people seriously ill. It kills people. So what we're putting in place is not there to do maybe if you want to do it. You need to do it to protect others, to protect our community, because this is a serious disease that we need to take seriously. Thank you.
Thank you. Now we'll take any questions you have.
Again, we'll take one question and one follow-up. We'll start with Natasha Pace at CTV. Go ahead, Natasha.
Hi there. My question would be for Dr. Strang. I wanted to start off with the long-term care or the nursing homes that are not impacted, but that there is staff members that have tested positive. I believe the latest one is the Mongolia home in Enfield. I'm wondering, now that there are cases connected to nursing homes that are popping up, what is your concern at this point?
So you faded out there. I'm assuming, I think your question was, what is the plan?
Concern.
Or concern. Well, we've always had the concern, and this is why I said earlier, why we, a couple of weeks ago, we put restrictions on no visitors, no day trips out of the facilities. It's very important that we isolate those long-term care facilities from the rest of the community as much as possible. We do have to have staff working in there, but all of those facilities have clear plans of making sure staff aren't ill, or adhering to self-isolation from travel if they're meant to be on self-isolation. However, we do know now there's clear evidence that in all three of these cases, the individuals who were working weren't working when they were sick. It wasn't that they were there when they were not supposed to be there. They were following the rules. But now we know that in the 48 hours before somebody becomes sick, they can actually be somewhat infectious to others. Not as much as when they're symptomatic, but there is a risk of them being infectious. So we are now doing our case and contact follow-up, including where people were in that 48 hours before they became sick. And it's through that we've identified these three cases. So it increases the importance of having plans in place in long-term care facilities. I think what I've seen done since Friday night in these three long-term care facilities is impressive. That the healthcare system has come together. The Nova Scotia Health Authority has stepped up to provide the appropriate support to their long-term care partners, to put plans in place, to give them the infection control and occupational health advice. Public health is in there working with the facilities to robustly do the contact tracing, and now the healthcare system is supporting them with plans of how we're going to treat people if they become sick. So the plan we have and our concern is not new, and we put the right steps in place as much as possible to protect long-term care facilities. And we have plans in place that, as I said, we rolled out in the last 48 hours if and when a long-term care facility did have a staff member. It's important to recognize that at this point there are no residents who have become ill, and we hope to keep that as to the best of our ability.
Go ahead, Natasha, if you have a follow-up question.
I do. This would also be for Dr. Strang. At this point, I guess you're still unable to say for sure if there is community spread, but today you did indicate that it is likely. I'm just wondering, when are we actually going to be able to confirm that there is likely community spread happening, or that there is community spread happening? Because a lot of people are quite unsure why. I guess that hasn't been clear yet.
So we have some criteria that when we follow up our cases, that if we can directly link somebody to a travel or to a known case, and we go back, I'll call it, 2 levels of separation. So if somebody was in contact directly with somebody who traveled, or if they were in contact with somebody who then that other person was in contact with somebody who traveled, that's two layers of separation. As long as we can make those links with those 2 layers of separation, we know it's not community spread. If we get into 3 layers of separation, so a contact of a contact of a contact, or we just can't explain how they got exposed, then we will come to the conclusion that it's community spread. We can only do that when we finish the investigation of each case. And as I said, some of our cases there is concern that it might be community spread just because of what we know about it, but we cannot make that firm conclusion until we've finished our investigation and seen for sure whether they meet one of those criteria. We just can't explain the exposure, or there are 3 or more layers of separation away from a known case or somebody who's traveled.
Next, we'll go to Brooklyn Curry from CBC. Go ahead, Brooklyn.
Hi, thank you. This is a question for Dr. Strang. You said seniors were tested in those long-term care facilities where there were COVID-19 cases and the results came back negative. But because none of them were symptomatic, are you concerned about the chances of false negative tests?
So we don't have false negative tests. We talked to Dr. Hatchett at the lab with his laboratory experts across the country. Are very comfortable that this is a highly accurate test. I think when you're talking about a false negative, just because they were tested negative yesterday, or that doesn't mean that they couldn't in 2 or 3 days become symptomatic and then test positive. Somebody has the virus in their body, it can take a few days for the virus to grow in the cell and replicate in their airways, in their nose and throat, and then to be released, and then you would detect it on a test and becoming symptomatic. So it's not really a false negative. It's just we know that a single test that is negative cannot tell for sure that somebody is not going to become symptomatic and then test positive. That is likely that's going to happen in upwards of 14 days since they were exposed. That is why all along we're saying people who have been exposed need to self-isolate for 14 days before we can say for sure you're not going to become sick and become infectious. That is why the residents in these facilities who were exposed yesterday and today will be in self-isolation or in cohorting in groups, isolated from the rest of the facility for that full 14-day period before we can be sure that they're not going to come down sick and then be allowed to go back into the general facility.
Brooklyn, go ahead if you have a follow-up.
Yes, this one is for Premier McNeil, actually. We do know that police were out yesterday telling people to get out of parks. They gave warnings, but they didn't issue any tickets yet. As the weather gets nicer, are you preparing to put stricter measures in place to have people obey public health orders?
We will be working with law enforcement effectively today to continue to make sure that Nova Scotians understand these restrictions are not just for a few of us. They are for all of us, and we expect all of us to abide by that. And law enforcement will take the necessary steps to ensure we do.
Next we'll go to Elizabeth McSheffrey from Global. Go ahead, Elizabeth.
Hi there. My first question is for Dr. Strang. Can you confirm a case of COVID-19 at the TD Bank on Mumford Road?
I'm not aware of that specific level of detail. I know all positive cases are followed up by local public health. I was on a call with the medical officers this morning about the cases that occurred in the last 24 hours. That specific location did not come up.
Go ahead with a follow-up if you have one, Elizabeth.
Yes, again for Dr. Strang. When we have confirmed that there is community spread, how is that going to change our response? Any of the restrictions in place? How are things going to intensify once we know that there is community spread?
So it'll change us. It's really in our messaging. It becomes even clearer and more important that all Nova Scotians are at risk, not just if you're related to travel. It'll become even more important that we all follow the advice around personal protection, the advice around social distancing, or the requirement around social distancing and self-isolation. We have already expanded our testing in a number of ways to be more actively looking for the community spread. I think it's only one day, but the fact that we did 800 tests over the last 24 hours and we only had 12 cases, the majority of which had clear links to travel, is somewhat reassuring that we're not seeing significant levels of spread within the community, if at all. That it is only one day, but we hope to continue to see that pattern and monitor that over time. We are actively looking at further ways that we can expand testing into community, and one of the things we're looking about is, we're actually starting to look at my epidemiology team, how do we're geomapping, so we're looking at locations of tests, and where we see clusters of tests, we're looking at ways we could move into the specific communities and do enhanced testing in communities. We don't have all that worked out yet, but that's part of what we're looking at, of how we would respond if and when we start to see cases of community spread.
Next, we'll go to Rose Saint-Pierre from Radio-Canada.
Yes, hi, good afternoon, Mr. McNeil. I have a question for you about the border between New Brunswick and Nova Scotia. Do you have any numbers on people who were refused to enter in Nova Scotia since you closed the border?
No, I don't have any numbers on those who went back home. We made it clear, though, obviously there's a lot of commerce that is happening between our respective provinces. We have essential services back and forth. That's why we have the separate lane. And we wanted to communicate to Nova Scotians coming home that we expected them to go directly home, to self-isolate for 14 days, not to stop at the grocery store, not to stop at any other shop, post office, but to go directly home. And we were communicating to other travelers that if you were coming into our province to socialize, we wanted you to return home. They could still enter if they chose to, but they would have to self-isolate for 14 days as well.
Do you have a follow-up, Rose?
No follow-up, thanks.
Go to Mike Tutton from the Canadian Press. Go ahead, Mike.
Hello. I was wondering if Dr. Strang could tell us what percentage of intensive care beds in the province are now occupied, and based on your best models, epidemiological models, when do you expect the maximum number of ICU beds to be needed?
So I don't have that number of today in that level of detail from the health authority about the number of ICU beds that are occupied today. I know in general they've been ramping down beds, and I think, as we heard Dr. Carr and Dr. Jangard a couple of days ago, we're about 60 to 70% of bed capacity in general in hospitals. There certainly are plans in place to expand and maximize the number of people that could be cared for if they need ventilators. I haven't had a look at the modeling in the last few days. I have a meeting coming up in the next day or two to look at the latest modeling pieces to see what the model shows about expected numbers of cases. But everything we're trying to do, our focus is on prevention. While the rest of the healthcare system ramps up to care for large numbers of people with various types of COVID-related illness, and we're maximizing that capacity, it's critically important that the only way we are going to maintain the ability to treat people as necessary in our healthcare system is if all of us today start taking seriously the need to go home, self-isolate if you're required to self-isolate, social distance, don't gather in social groups more than 5. Doing that prevents the spread of the disease and will protect our healthcare system and others in our communities.
Go ahead, Mike, if you have a follow-up.
At this point, then, how optimistic are you, Dr. Strang, that our healthcare system will not be overwhelmed in terms of the needs of the most seriously ill who need intensive care units?
So there's two things that make me give me encouragement and some hope. That first of all, I know how hard my colleagues in the healthcare system are working to have plans in place to maximize their ability to deal with people with COVID-related illness. We also know that by good fortune, we have implemented the strong measures very early on as COVID-19 started to become an issue directly here in Nova Scotia. Some of our other provinces, Ontario, Alberta, British Columbia, are implementing the same measures, but they're 2 or 3 weeks further ahead and they have much more disease. BC has already said which have significant impacts on their healthcare system. My colleague, Dr. Henry in BC, late last week was showing some signs of optimism that what they're doing in terms of implementing the same measures we've implemented in Nova Scotia is perhaps starting to show some flattening of their curve, but they have a much bigger peak in their curve that they have to try to flatten. I have to come back to again that it's in all of our hands, that if we do what we're requiring and asking people to do, that gives us the best ability to minimize the impact in our healthcare system. I'm not saying we're not going to see any impact, but it will give us the ability to be able to respond within the capacity that is in our healthcare system. And as challenging as these measures are, quite frankly, how we'll get to the point where we can start to lift these measures as early as possible will be if we all stick with what we're needing to do in the next few weeks. The people who aren't doing what they've been told and asked to do are putting the rest of us at risk and quite frankly making this a longer, more difficult challenge here in Nova Scotia.
Next, we'll go to Samantha Long from All Nova Scotia. Go ahead, Samantha.
Hi, this is a question for the Premier or for Dr. Strang. The press release notes that the grocery stores are packed over the weekend, and we know an employee at the superstore in Bedford has tested positive. So is there any additional measures that the province can implement to limit the spread, and would you consider shutting them down?
So I think it's one of those situations where we're asking Nova Scotians to use common sense. When you arrive at a grocery store and the parking lot is full, we ask you to go home and go back at another time or find another grocery store to go into. I know some of the grocery stores in the province are taking and limiting the number of people that can enter, and they wait there with someone at the door with a counter to go in and out. It is obviously an essential service, and it requires all of us to follow the advice of Dr. Strang when it comes to social distancing, especially when we're out to those essential service events. I again want to stress to every family in this province, identify someone in your family who can do the grocery shopping, and let that individual be the one who goes to the store. It's not a family outing. It needs to be one person going in, get what the family requires, and get out. And it requires all of us who are going in there to recognize that it is still, even though it's an essential service, it's still an environment where this disease can be passed along, and we need all of us to practice that social distancing that Dr. Strang and his team have been talking about.
Go ahead, Samantha, if you have a follow-up question.
Yes, yesterday Irving announced one of its employees had tested positive at the sawmill in Truro, and I'm wondering why the mill is still open.
I'm sorry, I didn't get the last of the question.
I'm wondering why the mill is still open.
Well, the reality of it is one employee has been identified, obviously, with the virus. They're continuing to have activity. There are still certain parts of our economy that are moving forward. As Dr. Strang and his team do with everyone that is tested positive, there's a follow-up to identify who their contacts have been, whether or not that has been distributed within that workforce, or whether the fact that the person who tested positive had even had any impact on that labor force. It is an environment where they can self-distance. It's an environment where we believe, and most employers are double shifting, having fewer people on site, at the same time trying to protect their workforce as they continue to keep some economic activity happening within our province, using best practices of Dr. Strang and, quite frankly, public health around the world.
Next, we'll go to Frank Campbell from the Chronicle Herald. Go ahead, Frank. We'll come back to you, Frank. We'll go to Kyle Shaw from the Coast. Go ahead, Kyle.
Thanks, Tina. For Dr. Strang, I'm wondering if my dog is putting me at risk. I take the dog for a walk. my neighbor's out for a walk, me and the neighbor say hi to each other, we're standing safely apart, but the dogs are touching each other, maybe I pet my neighbor's dog. Have we just ruined the intention of social distancing?
Yeah, no, this has been looked at, and is what we would call is this COVID-19 a zoonosis passed between humans, between animals and humans, and there's really no evidence at all that cats, dogs are part of the transmission of this. So as long as you're social distancing from your neighbor, you're the two dogs saying hi to each other face to face is not a problem.
Go ahead with a follow-up if you have one.
Yeah, thank you. It's for the Premier. It's a follow-up. It's come up a couple times about police and enforcing social gathering restrictions. Right, it came out that there's no tickets have been given yet. I'm wondering if there has been a guideline that they should not be giving tickets because this is early days, or as far as you're concerned, police may give a ticket if the case warrants it, in their opinion.
Well, obviously, police would execute the law as they see fit. I can tell you there was an educational component to this. The fact of the matter is the majority of Nova Scotians are respecting the law. I would say to you that the educational part is over.
Next, we'll go to Bill from Six Rivers.
Thank you very much. I'm concerned about the possibility of unusual delays for delivery truck drivers at the New Brunswick-Nova Scotia border. We're given to believe that in one case, the truck driver finally gave up and abandoned his trip to Nova Scotia after a 6-hour wait at the border. Is that possible, and is it common?
I've not heard of that, to be honest with you. We actually have an essential service line, which truckers are part of, medical teams that are coming through, people who are coming in to do shifts and go home, whether it's in Spring Hill at the correctional facility or other employers in that area. But commercial traffic has been given an essential service lane. Maybe the first day there was some delay, but in my understanding that's been working well. And we appreciate all those Nova Scotians who are coming home, taking the advice that's been given to them at the border, and that is that they go directly home without any stops.
Go ahead with a follow-up, Bill, if you have one.
Mr. Premier, we're led to believe it was yesterday, and the delivery was restaurant supplies. Perhaps that's not included in essential services.
It wouldn't have mattered if it's the commercial activity of trucking would be part of that. We don't look at what's on the manifest of the truck. They're bringing goods and services inside of across the country. We have an essential service lane, but I have not heard of that. But I will have a look at it for sure.
Next, we'll try again to Frank Campbell from the Chronicle Herald. Frank, are you there? We'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Thank you. I have a question for Dr. Strang. I've obtained a letter from John Schofield, the director of the province's jails, about the procedures being made to clean and protect against COVID. And he ends it with a remarkable statement that, and I'll quote here, our performance can be compared favorably to increasing cases in the public domain. He seems to be saying that it's safer in jail than outside of jail. Do you have a response to that?
I haven't seen that direct correspondence, so I can't really comment on that. I do know that there is a group from the Nova Scotia Health Authority with an infectious disease physician and infectious control people that are providing support to our correctional facilities to come up with appropriate protocols in how do we keep our correctional facilities as safe as we possibly can.
Go ahead, Tim, with your follow-up.
Yeah, the same sort of question, but broader, directed at the Premier, which is, I've asked you before about assisted living complexes where there's up to 900 people in various, with people with disabilities living in these centers, and quite a large number of them want to and are ready to go to community housing, but there's no funding available to make that move. You've made millions of dollars rightly available for other COVID responses. Have you directed any new resources into helping those people move out of those facilities?
Well, the reality of it is, Tim, what we're doing is following the advice of Dr. Strang to ensure that we provide, or that we follow public health advice to protect ourselves and protect Nova Scotians. We will continue to make sure that all of our partners and facilities that are taking care of Nova Scotians follow those advice, that we provide them with the supports that are required as we continue to meet what is our objective, is that every Nova Scotian who wants to and can live independently will have that opportunity, and we're working towards that as we've done over the last number of years. But we are now focused on how do we make sure that we follow public health advice to ensure that we can keep our population healthy.
Thanks, Tim, and that's all the time we have for questions today. Go ahead, Premier.
Thank you, Tina. I would like you to take a moment and just look at a few pictures from yesterday. People are still driving to parks and beaches. Even after police put up yellow tape, which we all know means do not enter, they ignored and went in anyway. We are certainly better than we were last weekend, but we still have a long way to go. I'm hearing stories of grocery stores packed with people, groups out playing sports. You are the reckless few. And not only am I upset and Dr. Strang is upset, your fellow Nova Scotians are upset with you. We've had it. We've all had it. I want you to think about this. Young children who are so confused, parents who are trying to explain to them why they can't cross the street to play with their best friends and why they can't go out and play street hockey. Moms and dads are working so hard to keep them safe and help them understand. But when the reckless few blatantly disobey Dr. Strang's orders and kids see you outside acting like everything is normal, you're confusing them and putting them in harm's way. And it's just not children, all of us. We want to come out of this. We are tired of being cooped up. But this is not going to end anytime soon if you, the reckless few, continue to break the rules. The single most important thing that we can do is physically distance ourselves from each other. It's not just Dr. Strang and I who are saying this. Public health experts around the world are saying it. In fact, many are looking at New York right now, where there are hundreds of deaths, and saying if they'd done distancing sooner, the situation might not be as bad. I want to thank Nova Scotians, the majority of you who are listening to the advice to physically distance yourself. The good doctor and I appreciate how hard you are working to help flatten the curve. And I also want to thank law enforcement for the work they did this weekend to send the reckless few home. But you are still out there despite all of the warnings. So we need to take this up a notch. I have called Justice Minister Mark Fury and asked him to direct law enforcement to escalate their efforts from education to enforcement, ticketing and towing if necessary. I had hoped it wouldn't come to this, that everyone would listen, and so many of you are. The Facebook kitchen parties of the amazing Nova Scotia music, such a wonderful example. We are putting iPads in long-term care facilities so that our seniors can stay in touch with their loved ones. And we've shut down businesses. People are losing money, and they are scared, but they are following the rules and stop social gathering to help us stop the spread of this virus. But the reckless few, shame on you. If you can't do your part, law enforcement will do it for you.